I like to keep things super simple. That's just the way that I like to look at it. And if you just think about what we're trying to help you do, we're trying to help you pare down to proteins, fruits, vegetables, and healthy fats. And you can look at basically any anatomy book in terms of saying, like, there's a cat here that joined us, right? And so when you own a cat, and I'm not trying to compare a human to an animal, but this is just a great like segue to kind of put it in perspective. But when you own a cat, you say, oh, this is what they eat. So this is my responsibility to give it what it needs in order to thrive and survive, or survive and thrive, however you want to look at it. And we are dynamic beings, very much like the cat, right? But we have a certain, if we came with a instruction manual, right, to support our cells to survive and thrive, that is what we're trying to guide you to within our food list. And to layer, we're trying to minimize and highly likely inflammatory response as a result of certain foods, right? And it does come with a templated food list and those sorts of things, but that is, as Janelle, mentioned, where your individual practitioner can really have that open conversation with you to ask you, like, here's what we're trying to do. What are you willing to do? Because what we don't want is for you to feel like you're being forced in a direction. What we do want is to give you that information, back it with our expertise, right? And our experience, and allow for you to ultimately say, you know what, I feel very good about what my plan is moving forward. And I don't feel in between, my practitioner and my MD. And I feel like I'm fully supported. And I've got the tools, resources, and expertise, that open door policy that we offer within our community and your appointments, you know, to help guide me through this process. So hopefully it's something that you've never had access to. Many people that come to us don't have that, prior to coming to us, but definitely utilize it. And when you utilize it, it's there to like put you at ease and allow for you to take a deep breath and not feel like you're going, being battling in between the two professionals. Because to be quite honest, you need both of us on your health board of directors, right? So let's make that clear. In terms of your practitioner or your functional medicine doctor. And if you don't have a regular practitioner, I see some people like, I don't want to do that, that's okay. But that's your choice, right? And when needed, just understand, I want you to have confidence in that person or people as well, because each individual on this planet will definitely need the medical community, and we're grateful for what they can do in the time of need. In the time of need may pare down. Our definition in terms of time of need may be different than, the majority of people out there. But if you clearly understand they're looking for and searching for pathology, sickness, and disease, and they're there to manage that, and then we're there to help you gain health and restore, an optimally functioning body at the cellular level, then you can hopefully see where you need to cross maybe with them, with us and them for a certain period of time. But the goal is to empower you so you become less dependent on having to manage any one symptom, sickness, pathology, or disease. Optimization, right? Less dependency. That's our area of expertise.
Hmm.
So, you can know that we're not trying to do, like, a pregnant woman could eat what we're teaching people to eat, right? So there's really no contraindication. Taking an aspirin is, more controversial than what we're doing and guiding you to do, if you will, in terms of like risk. Okay. Um, so in other words, we're trying to give your body the nutrients that it needs to survive and to allow for absorption to occur at the cellular level properly, and to get rid of the nasty waste removal issue, that, accumulation of toxins over the years. So then we can say, okay, this body is finally creating a really solid foundation to build upon, so you can go and do what you want to do, and what you love doing in life, right? The hard part is when you have a disagreement like that. But what I always guide people to do is to know and understand that you're the one in control in that conversation, right? Because you're at the front of the room, not them. They're consulting you, they're providing you information. And so I want you to to understand this is that one, your body's always trying to help you. And two, there's no doctor on this planet that knows your body better than you do. If you have confidence with that doctor, great. Have an open conversation. If you feel like you don't have confidence with that doctor, then it's probably time to find a new one because doctors are just human. The other thing is they're trained more heavily in toxicology, which is medications. Okay. And there are two tools, whether you go to doctor after doctor, and then it elevates to specialist after specialist. And this is a period of months and months and months and months in terms of the cycle that takes place. There are two end tools, and this is not because I have anything against the medical community. You heard me say, like, I'm a fan for what they can do because they can do truly amazing things, but we have to put them in the place that they belong, right? They're not going to help you get healthier. Okay, we are. And that's where there are two tools when it really comes down to it is after you go through this cycle is either more medications or surgery. And again, that's not a take on them. That's just what their tools are, regardless of the diagnostic tools that they use, blood work, CTs, x-rays, so on and so forth, to identify what's going on in your body. Okay. And so again, they can be life-changing tools for some of us at some period of time in our life, but they're not used to restore and gain health. And that's why you're all sitting here today. It doesn't have to be a contentious conversation. It can just say, oh, okay, well, I wanted to have this conversation with you. Clearly, that's not something that, how can a doctor not be open to nutrition when that's really what fuels the body? Okay. That's the basis of how we need to survive. Okay. And so that's where if you feel any angst, and that's unique to the individual, then you go find somebody that you don't feel that way and you can have an open conversation with. But I will say people go to them with those conversations thinking that they have some authority and expertise in that area. And you said it yourself, they don't, unless they're personally diving into that outside of their medical training. Knowing who to go to for what is also empowering. So hopefully, if you want to have further conversations with your practitioners, they're capable, fully capable of having that conversation as well. If anybody's curious, right? If you need somebody to bounce things off of that way. So